Hello and welcome back to our channel. I'm Tajana, and it's great to have you with us today. In this video, we're going to tackle a topic that has profoundly impacted all our lives over the past few years: COVID-19. Our goal is to provide a comprehensive overview, breaking down the essential information you need to know. We'll cover everything from the virus itself to the crucial steps we can take to protect ourselves and our communities. Let's dive right in. First, let's clarify what COVID-19 is. The name is short for Coronavirus Disease 2019, and it's caused by a virus called SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. This virus primarily spreads through respiratory droplets that are released when an infected person coughs, sneezes, talks, or breathes. You can become infected if you inhale these droplets or touch a contaminated surface and then touch your eyes, nose, or mouth. Once inside the body, SARS-CoV-2 targets cells in the respiratory tract, using the cell's machinery to replicate itself and spread further, which is what leads to the symptoms of the illness. The symptoms of COVID-19 can vary widely from person to person. Many people experience mild to moderate respiratory issues, similar to a common cold or the flu. Common symptoms include fever, a dry cough, and fatigue. Others might experience a loss of taste or smell, muscle aches, headaches, sore throat, or nasal congestion. However, for some individuals, the disease can progress to a much more severe state. This can involve serious complications like pneumonia, acute respiratory distress syndrome, ARDS, and other life-threatening conditions that often require hospitalization and intensive care. The typical development of the illness sees symptoms appearing 2 to 14 days after exposure to the virus. To determine if someone has an active infection, different diagnostic tests are used. The most reliable method is the PCR test, which stands for polymerase chain reaction. This highly sensitive test detects the virus's genetic material from a sample, usually taken with a swab from the nose or throat. Another common method is the rapid antigen test. While less sensitive than the PCR test, antigen tests are faster and can provide results in minutes, making them useful for quick screening in various settings. These tests work by detecting specific proteins from the virus. Choosing which test to use often depends on factors like symptom presence and potential exposure. When it comes to managing the disease, treatment options have evolved significantly. For mild cases, care usually involves rest, hydration, and over-the-counter medications to manage symptoms like fever. For more severe cases, hospitalized patients may receive antiviral drugs, anti-inflammatory medications, and supportive care like oxygen therapy. The most powerful tool we have in combating COVID-19, however, is vaccination. The vaccines have proven to be incredibly effective at preventing severe illness, hospitalization, and death. They work by preparing your immune system to recognize and fight off the SARS-CoV-2 virus, without you having to get sick first. Finally, let's talk about the key protective measures we can all take. These are simple yet highly effective actions that help reduce the spread of the virus. Wearing a well-fitting mask in public indoor spaces or crowded areas provides a physical barrier that can block respiratory droplets. Practicing good hygiene, which includes frequent hand washing with soap and water, or using an alcohol-based hand sanitizer, is essential. Maintaining physical distance from others, often called social distancing, also helps to minimize the chances of transmission. These measures, when used together, create multiple layers of protection. That brings us to the end of our overview of COVID-19. We've covered the nature of the virus, its symptoms, how it's diagnosed, and the critical roles of treatment and vaccination. We also reviewed the simple but effective measures we can all take to keep ourselves safe. It's vital to stay informed through reliable sources and continue to look out for one another. Thank you so much for watching. Stay informed, stay safe, and we'll see you in the next video.